Hello and welcome to today's video. If you have been wondering about Mucinex, how it works, or whether it's the right choice for your congestion, you are in the right place. In today's video, we will be diving into everything you need to know about Mucinex. We will start with a quick introduction to Mucinex, what it is, how it works, and the types of products available. Then we will go over the proper dosage, common side effects, and essential safety tips. If you are exploring alternatives, we will cover over the counter and prescription options. We will also discuss some natural remedies for mucus relief that you can try at home. We will wrap up with a look at some frequently asked questions and myths surrounding Mucinex. This video is packed with clear, easy to understand information backed by science. So stick around to make sure you have all the facts you need to make an informed decision. Let's get started. Mucinex is an over the counter medication with Guaifenesin as the active ingredient. It's classified as an expectorant, which means its job is to loosen and thin the mucus in your respiratory tract. This makes it easier to cough it out. People often use Mucinex for colds and the flu or even bronchitis. However, it's not effective for dry coughs or allergies that don't involve mucus buildup. Mucinex or guaifenesin is designed to target and manage the mucus in your respiratory system. Let me break it down for you. When you are sick, your airways produce mucus to trap the bacteria, viruses, and irritants. However, this mucus often becomes thick and sticky, making it harder to cough up. This is where Mucinex steps in. Mucinex works by thinning this mucus, reducing its stickiness so it can flow more freely. Think of it like turning a sticky glue like substance into water. It becomes much easier to clear. Here is how it works on a deeper level. So, Mucinex stimulates the glands in your airways to produce thinner mucus, which helps loosen the buildup in your chest, throat, or even your sinuses. This allows your body to naturally expel the mucus when you cough. Now, here is something important. Mucinex does not suppress your cough. Unlike some medications, it actually works with your cough, making it more productive. This is crucial because coughing is your body's way of clearing out mucus. And another thing, it does not dry out your mucus like antihistamines do. Instead, it focuses on making the mucus easier to manage. This makes Mucinex especially helpful if you have a cold, the flu, or even the bronchitis, where mucus buildup can feel overwhelming. So, by clearing out this mucus, Mucinex also helps prevent complications like secondary bacterial infections, which can develop when mucus sits in your airways too long. So, while Mucinex won't cure your cold, it plays an essential role in helping your body fight it off effectively. Now, let's dive into different type of Mucinex products available so you can find the one that works best for your symptoms. First up, we have Mucinex Regular. This is your classic Mucinex containing only guaifenesin, the expectorant that loosens and thins the mucus in your chest. It's perfect if you are dealing with chest congestion but don't have any other major symptoms like coughing or a fever. It comes in extended release tablets, so you only need to take it every 12 hours. And for those who don't like pills, there are liquid options too. Next is Mucinex DM or dual action product. The DM stands for dextromethorphan, which is a cough suppressant. This is a great option if you have chest congestion and a nagging cough that won't let you rest. It loosens mucus while also calming an annoying cough, making it ideal for nighttime use when you need uninterrupted sleep. Then we have Mucinex Fast Max, the multitasker. This is for those days when you are battling multiple cold or flu symptoms like fever, aches, and sore throat, and congestion all at once. Fastmax combines guaifenesin with ingredients like acetaminophen for pain relief and phenylephrine for nasal decongestion. It's available as liquid or caplets, so you can choose what works best for you. If sinus pressure is your biggest issue, Mucinex Sinus Max is the product to look for. It includes decongestants like phenylephrine or pseudoephedrine, which help reduce nasal swelling and open up your airways. This is one perfect for if you have dealing or if you are dealing with sinus headaches, clogged sinuses, or a stuffy nose. And lastly, we have Mucinex Children's, which is specially designed for younger users. Kid often struggles to take medications, so this one comes in liquid form with flavors to make it more palatable. It's great for treating chest congestions in children, but make sure you use the right dose based on their age and weight. Each of these products is tailored to specific symptoms, so it's really important to read the labels carefully and choose the one that matches what you are experiencing. If you are ever unsure, your pharmacist or doctor can help you guide you. Mucinex is widely used, but it's essential to know who can safely take it. For adults over 12 years old, regular or maximum strength versions work well. Kids between 6 and 12 should stick to children's formulas or formulations as their bodies process medications differently. If you are pregnant or breastfeeding, Mucinex is generally considered safe, but there is limited research, especially during the first trimester. It's always good idea to ask your doctor first. For elderly individuals, lower doses may be recommended because their bodies metabolizes drugs more slowly. And if you have chronic conditions like asthma, kidney issues, or high blood pressures, you will want to obviously consult to your doctor before using Mucinex, as certain formulations like Mucinex D contain decongestants that may increase your blood pressure and worsen the symptoms. Now let's talk about how to properly use Mucinex. So for adults, the typical dosage form or the typical dose is 600 mg of regular strength every 12 hours. If you are using maximum strength, that is 1200 mg for every 12 hours. But remember, never exceed 2400 mg in one day. It won't help you recover faster and it could lead to unwanted side effects. For kids aged 6 to 12, the dose is smaller, 100 to 200 mg every 4 hours, with a maximum of 6 doses per day. Children under 6 should not take Mucinex unless directed by the doctor. To get the most out of Mucinex, swallow the tablets whole with a full glass of water. Crushing or chewing the extended release tablets can interfere with how the medication is absorbed. And here is a pro tip: drinking plenty of fluids throughout the day helps Mucinex work more effectively, as it needs water to thin and loosen the mucus. Mind it. Like any medications, Mucinex can have side effects. Although they are generally mild, some people might feel a little nauseous experience and upset stomach, dizziness, or a mild headache. To minimize this, try taking Mucinex with food or a snack. More serious side effects are rare but can happen. Allergic reactions such as skin rashes or swelling should never be ignored. If you notice these or symptoms like severe dizziness or confusion, stop taking Mucinex right away and consult a doctor. If you are using Mucinex D, which contains a decongestant, you might experience changes in your heartbeat. Again, this is a rare case, but something to watch for if you have underlying heart conditions. One of the most common questions is whether Mucinex can be taken with other medications. The good news is that it's generally safe to pair Mucinex with over the counter pain relievers like Tylenol or Advil. It also works well alongside antihistamines for allergy related symptoms. However, you should avoid combining it with other cough suppressants unless a doctor has specifically recommended it. And definitely avoid alcohol while taking Mucinex, as it can make you feel more drowsy or dizzy. If you are already on prescription medications, especially for conditions like high blood pressure or depression, it's good idea to talk to your doctor or pharmacist first. Some Mucinex formulations like Mucinex D contain decongestant that can increase the blood pressure or interact with certain drugs. When you are looking for alternatives to Mucinex, you have a variety of over-the-counter options to consider. Let's explore some of them. First up is Robitussin. So, which is also contains Guaifenesin, the active ingredient in Mucinex. It comes in liquid form, which some people may find easier to take, especially for children or those who struggle with swallowing tablets. Next, we have Sudafed or Pseudofed, which is decongestant that targets nasal swelling. It's great for sinus related congestion, but it won't help thin mucus like Mucinex or Robitussin. So, if you are dealing with multiple symptoms like fever, aches, and cough, NyQuil and Dayquil are excellent choices. They are designed to provide comprehensive relief during daytime and nighttime hours. For allergy related congestion, Benadryl is a good option. However, keep in mind that it causes drowsiness, so it's best to take at night. If OTC options or over the counter options does not work, consult your doctor for prescription alternatives like nebulizers or inhalers. These are often used for chronic respiratory issues such as asthma or severe bronchitis. When choosing any medication, always match it to your specific symptoms and avoid combining products that have similar ingredients, as this can lead to overdosing on certain components. Follow the dosage instruction carefully for the best results. Let's talk about some natural remedies for mucus relief. These are great if you are looking for non medication options to alleviate the congestion. One of the most effective remedies is steam inhalation. Simply boil water, carefully lean over the steam, and breathe deeply. Adding essential oils like eucalyptus or peppermint can enhance the effect and help open up nasal passage even more. Another tried and true method is drinking warm fluid, such as herbal teas, soups, or warm waters with honey and lemon. These not only help thin mucus but also soothe an irritant throat. So, warm fluids can also boost circulations, which aids in faster recovery. Now, if you are looking for a natural expectorant, try honey and ginger. Honey coats the throat and acts as a natural cough suppressant, while ginger's anti inflammatory properties can help reduce irritation and boost the immunity. For throat mucus, a simple salt water gargle can work wonders because gargling with warm water or warm salt water helps break down the mucus and soothes any swelling or irritation in the upper respiratory tract. Hydration is key, so aim to drink at least 8 to 10 glasses of water per day. Proper hydration thins the mucus, helps your body flush it out more efficiently. Adding a humidifier to your room can also keep the airways moist, especially during the dry seasons. Finally, if you notice that certain foods like dairy make your mucus thicker, try cutting back on them. Instead, focus on a balanced diet rich in fruits, vegetables, which provide vitamins and antioxidants to support your immune system. These natural remedies are simple, effective, and can often complement with other treatments you are using for mucus relief. Now let's quickly go through some frequently asked questions to clear up any remaining doubts you might have about Mucinex. Which Mucinex product is best for chest congestion? So if you are dealing with chest congestion, the best Mucinex options are Mucinex regular or Mucinex maximum strength, as both contain Guaifenesin, which works to thin and loosen mucus in the chest and helping you to expel it more easily. Can I take Mucinex DM for dry cough? Mucinex DM is specifically designed for productive coughs, so it's not ideal for a dry cough. For dry coughs, look for a medication with a cough suppressant like dextromethorphan or dextromethorphan. Okay, now can I take Mucinex on an empty stomach? Yes, Mucinex can be taken on an empty stomach. However, if you have a sensitive stomach, taking it with food may help you prevent the discomfort. Can Mucinex cause drowsiness? No, Mucinex itself does not cause drowsiness. However, if you are taking other medications with it, such as antihistamines, be sure to check their side effects since they might cause the drowsiness. Can Mucinex be taken with alcohol or caffeine? It's best to avoid alcohol when taking Mucinex, as it can increase drowsiness or cause other interactions. As for caffeine, it's generally safe to consume in moderation, but avoid excess, as it can lead to dehydration, which may worsen your mucus buildup. Can I take Mucinex if I have asthma or allergies? You should always consult your doctor before using Mucinex if you have asthma or allergies, as your doctor will be able to confirm whether it's safe for your condition or not. Is Mucinex safe during pregnancy or breastfeeding? For pregnant or breastfeeding women, it's always recommended to consult your healthcare provider before taking Mucinex, as it's generally advised to avoid unless necessary. Your doctor can suggest alternatives that are safe during the pregnancy. Does Mucinex interact with high blood pressure or diabetes medications? Okay. So, if you are on medications for high blood pressure or diabetes, be sure to consult with your doctor before taking Mucinex, especially if it contains additional decongestants, as this may interfere with your treatment. Can Mucinex help with post-nasal drip or sinus infection? Yes, Mucinex helps relieve post-nasal drip and sinus congestion by thinning mucus, making it easier to clear out the sinuses and the throat. Can Mucinex be used for COVID-19 related symptoms? While Mucinex can help with mucus relief, it does not treat COVID-19 itself. It's important to consult with a healthcare provider for the best course of treatment for COVID-19 symptoms. Does Mucinex help with fertility or cervical mucus? There is no strong evidence to support that Mucinex improves fertility or cervical mucus. If you are trying to conceive, it is a good idea to speak with your doctor for advice on how to improve the fertility naturally. Can Mucinex be used for ear infections or eustachian tube dysfunction? So, Mucinex is not designed to treat ear infections or eustachian tube dysfunction. It may help if you have sinus congestions or affecting the ears, but always seek medical conditions or medical advice for ear infections. Is it true that Mucinex can improve voice clarity for singers? While Mucinex can help clear mucus, it does not specifically improve voice clarity for singers. It may reduce mucus buildup in throat, but it won't enhance vocal quality. Can I take Mucinex for more than 7 days? Okay, generally it's not recommended to take Mucinex for more than 7 days without consulting a doctor, as prolonged use may worsen the symptoms or mask an underlying conditions. Is Mucinex safe to take with antibiotics? Yes, Mucinex is typically safe to take alongside antibiotics if you are treating a respiratory infection. However, always check with your healthcare provider to ensure no interactions between the two medications will occur. I hope this video answered all of your questions about Mucinex and helped you make a more informed decision about your health. If you found this video helpful or useful, I would greatly appreciate it if you could subscribe the channel. My subscriber count still is growing and your support really means a lot to me. Thank you so much for watching and take care.